Hi, I'm Jesse Adler, and welcome back to my YouTube channel. Today we'll be doing the Tenderfoot requirement 4A, which is provide first aid for the following situations. So first we'll be doing simple cuts and scrapes. So if you get a simple scrape or a little cut on your finger or something, then what you want to do first is, if you have it, wash it off with water and soap to get all of the germs out, because you don't want it to become infected. And then next what you want to do is, if you're not allergic, or the person you're treating is not allergic, then put some antibiotic ointment on it, like Neosporin or something. And then put a bandage over that, make sure it's sterile, not used on someone else, so you can spread infection. But yeah, bandage it up and it will heal in good time. Next we'll talk about treating blisters on the hand and foot. So first, before you get a blister, you want to make sure that you're wearing socks that fit you, and if you can, wear work gloves while you're working so that a blister doesn't develop. And secondly, before you even have a blister, you're going to have something called a hot spot, which is a little red area wherever it is. Normally when you're working, it's rubbing there or something, and it kind of hurts. So if you get one of those, try to stop working or whatever you're doing. But if you can't, just pay attention to the area and try not to rub against that area. But once you have a blister, it's going to look like a little bubble over your skin, and there's some stuff, like some liquid inside. What you want to do is get some moleskin, which is a little like fabric material that you should have in your first aid kit, and cut an area bigger than the blister and put it on. Normally there's an adhesive side to it, so you can just stick it on. And then right then, if you can stop working, that would be good, but if you can't, just pay attention to the area and really try not to put pressure on it, because you don't want the blister to pop. Because if the blister pops, then you could infect the area in it. But if the blister does happen to pop, make sure to keep the area sterile to prevent infection. And yeah, make sure what you're using is sterile. And yeah, try not to get blisters. Sometimes they happen because you have a loose-fitting sock and it's rubbing, or like your feet are wet and they're just rubbing in the water. But yeah, that's what blisters are on your hand and feet and how to treat them. So now we'll be talking about how to treat minor or first-degree burns. And that's the first of the 3 types of burns. And this could be if you touch a hot pan on the stove, or you get sunburn or something. It's just a red area that doesn't feel very good, and it got burnt. Might be red, or yeah. So yeah, what you want to do is, if you can, run it under some cool water, which will relieve the swelling and make it feel better. But don't put ice on it, because that could further damage the skin, which is already a little damaged. And if it's from a sunburn, make sure next time to wear sunscreen, and maybe put some aloe vera gel on it, which will make it heal faster and make it not feel as bad. But yeah, there's not much that you can do other than relieving the pain and stuff. So yeah, they're not that bad, but they're pretty often that you get them, so that is how you treat them. So next we'll be talking about the bites from insects. So first, ticks. You may have heard of them before. They're little insects that bury their heads in your skin. So what you want to do to make sure that this doesn't happen is wear some longer clothing, like long pants and long sleeve, even if it's hot out, maybe a breathable material. And then also, after hiking or camping or whatever, check your ankles and arms and anywhere on your body that they could have gotten on. So but let's say you do get bitten by a tick. What you want to do is put some gloves on and use some tweezers and gently pull them out, maybe rocking side to side a tiny bit. This way that you don't detach their head from the rest of their body and keep their head inside of you, because you don't want that. So you'll kind of rock them out, and then wash the area with soap and water and put some antiseptic on there so that it doesn't become infected. So next we'll be talking about chiggers. Chiggers are little creatures that are almost impossible to see, and they latch onto you and inject venom into you and feed on your skin, and then jump off after a few days. So, as you can probably think of, you can stop this if after you hike, you take a shower or something of that manner where you wash yourself off and check for these. So that would help with those. Also, the long clothing, same thing for really all of these. Next, we'll be going to spiders, and you've probably all had a spider bite. They just turn into these little itchy welts kind of on you that itch and then go away after a few days. But there are some venomous spiders, and those are the black widow and the brown recluse. That's some of them. And if you get a bite from them, or you think you did, you should probably go to the hospital and get it treated so that it's not really, really painful, because they can be really painful. And yeah, it might not hurt right away. Like a black widow bite, it's not gonna hurt right away. It might hurt after like half an hour. But you want to go to the hospital right away, because if they can treat you early on, then it'll be better in the long run. So next, insect stings. By this, it's just like bees and stuff. So if a bee stings you, it's going to be a little stinger that you can see in yourself, a little brown stinger. And it's going to have a little sac at the top, and the pointy end is going to be in you. So there's two different ways, two different theories that people have come up with for getting this out most recently. So one of them is you hunt around and you try to find a credit card or something thin like that, and you kind of scrape it out with that. That way you don't squeeze the stinger and inject more venom into you. If you squeeze the sac part, it'll inject more venom in. And the second way is you just get it out as fast as you can, rather than trying to hunt around to find a flat object. So research it for yourself, find out which way you would prefer, and then remember that when you get stung by a bee, because you probably will sometime in your life. And that is all for the bite and stings of insects. So next we'll be talking about treating a venomous snake bite. So if you're in North America like I am, the only venomous snakes you'll have to worry about are pit vipers and coral snakes. And those are both families of snakes. So pit vipers are the ones you're probably used to seeing, like on TV or something. And they have a kind of triangular head, like rattlesnakes, copperheads, or cottonmouths. And coral snakes have black snouts and red and yellow bands, separated by bands of black. So you just have to remember that. If you see that kind of snake, you want to stay away. But let's say you do get bitten. So this is if someone else gets bitten and you're treating them. So you calm them down, wash the wound. Obviously, if the snake is still there, don't approach them because you're going to injure yourself. But once the snake is gone, you wash the wound, like any open wound, and you remove, this is very important, you remove any jewelry, rings, bracelets, anything. Because what it's going to do is it's going to start puffing up, the skin is, and if there's jewelry, like a, let's say they have a bracelet on, then the jewelry's going to stay where it is, it won't expand, and it's going to cut off circulation. It could even make they couldn't use their hand again, like a tourniquet. And if it's on an extremity, restrict the movement as much as possible. Don't let, because if they move around or get really scared, their heart will start pumping, and it'll get the venom around faster. So calming them down and making them stay in the same place will make it so it takes a longer amount of time, increasing the chance for less damage to them. And if you're in an area with cell service, make sure you call 911 as soon as possible to get emergency help. If you're not, maybe use a radio or send out a signal flare, because it's really important to get professional help. Like, this isn't something that you can treat by yourself. And while you're waiting for them to help, just keep them staying calm and maybe put them in a shock position, because that's really all you can do. But whatever you do, don't elevate the affected limb, because that's going to get the venom further into their body. So yeah, really just overall stay calm, get emergency services, and don't elevate that limb. So next we'll be talking about treating nosebleeds. And you've probably all had one or seen someone that's had one. And they kind of look pretty bad because there's a lot of blood, but really it's not a huge deal. And the bleeding usually only goes for a few minutes. But while it is going, have the person sit forward like this and pinch firmly but gently high up on the nose like that, just below the bone. And apply pressure on the upper lip, just below the nose. And maybe if you have one, hold an ice pack up on their nose and surrounding area. And what that's going to do is make sure the blood doesn't go down your throat and stop the bleeding. So whatever you do, don't like go like that and put your head back, because that's going to make the blood go down your throat, and that's not good. And after about 10 minutes, stop doing that. It should be gone. And if it's not, you should not have them blow the nose, because that's going to have it start again. And if it continues for like more than 15 minutes, like really, really prolonged, seek medical attention, like call 911 or get them to the hospital, because that's abnormal. But really, it's not a big thing to worry about if it's just a few minutes. And yeah, that's what you can do to help. So right now we'll be talking about sunburns, and I already covered this earlier in the video, so it's just a recap. You want to wear sunscreen to prevent it, wear sunscreen if you're going out in the sun again after you got a sunburn, and put some aloe vera gel on there to help with it. So that's all for sunburns. So next we'll be talking about frostbite. Frostbite is what happens when ice crystals actually begin to form on your skin and you get really cold. So this is past hypothermia, you're freezing cold. Maybe you're climbing like a snowy mountain or something. So sometimes they won't even know that's anything wrong, the victim. They'll just complain that their fingers are numb, their toes are numb, maybe their ear or cheek is numb. So also another indicator of frostbite is a gray patch on their skin. That's going to be ice crystals forming. And treat it by first moving them to a shelter area, like a tent or a building or something. And if their hand or their ear or cheek is cold, maybe remove some of your clothing and slip their hand in your clothing to put it against your warm skin. And if you suspect that the frostbite is really severe, like it has gone untreated for a while, help the person to get into dry clothing and wrap the injured area that maybe is a little gray or something in a blanket and get a doctor as soon as you can. Like, to get them to the hospital as soon as you can. And when there's no chance that a frostbitten area will refreeze, rewarm the injury, place it in some warm water, although not super hot because that could scald them, and just wait until the normal color returns. And if it's on a hand or foot, put some gauze on it that's sterile between the fingers or toes. And do not attempt to rewarm by placing it next to a fire or something, because that could even burn the tissue, so then it's going to be frozen and burned, which is even worse. So that's what you do for frostbite. Hope you never have to do that. So now we will be talking about choking. So the natural response to choking is to put your hands up around your neck, and that is what most people will do if they are choking. And if they're doing that, you should ask them if they're choking, because if they are choking, they will not be able to respond to you, so you'll know it isn't just a prank or they're not just teaching someone what to do, like I am. So if someone's doing that and their face is turning red or purple or something, you should call 911 or send someone to call 911 if you're in a public area, and tell the choking person that you know first aid and that you're going to help them, because they might think that you're just trying to hurt them even more and like fight you. So if they can cough, speak, or breathe, they know that some air is getting to the lungs, so encourage them to cough it up and maybe hit them on their back so that they can cough it up. But if they can't, like if it's really severe, then you're gonna do the Heimlich maneuver, which is stand behind the victim and place your arms in front of them below their stomach, below their diaphragm, and move up in that kind of motion, which will try to get the thing out of their throat. And try doing this until the thing is coughed up, or until medical help arrives, because they will know what to do. So yeah, that's what you do if someone's choking. Yeah, so recap, call 911, and then if they can get some air to their lungs, hit them on the back, try to get them to cough it up by maybe laying down or something. And if that doesn't work, then do the Heimlich maneuver, which is going like that with them in front of you. And yeah, that's what you do.